You wake up with a fever and strange aches, nothing too alarming at first. But then, a few days later, you notice a rash, and it's spreading fast. Is it just a bad reaction to something you ate? Or could it be a virus you've never heard of but should be worried about? It's called MPox, and recognizing it early could stop it in its tracks. Today, we're breaking down the key symptoms you need to watch out for, so stay with me, you don't want to miss this. MPox, also known as monkeypox, is more than just a health concern in remote regions. It's becoming a global issue. As more cases surface outside of its historical regions, it's critical to understand the early warning signs. What makes this virus particularly dangerous is that the initial symptoms are easy to overlook. They mimic common illnesses like the flu or a skin infection, which delays diagnosis. Today, we're not just talking about spotting a rash. We'll explore the subtle early signs that can often be dismissed and how identifying them can save lives and prevent outbreaks. MPox isn't a new disease, but its recent rise in unexpected places has caught many off guard. Without quick identification, the virus can spread before it's even recognized. Early symptoms like fever and aches look like the flu or a viral infection. That's why many people delay seeking treatment or unknowingly expose others. Catching MPox early could mean a shorter illness, reduced complications, and, most importantly, less spread. If you're aware of what to look out for, it's easier to help stop this virus from reaching epidemic levels. The first red flag is a sudden fever, often accompanied by intense fatigue and headaches. These symptoms usually show up 1 to 2 weeks after exposure. You might think it's just a mild infection, but when coupled with the next symptoms, it's time to pay attention. Swollen lymph nodes are a unique characteristic of MPox, setting it apart from other viral infections like chickenpox or smallpox. Lymph node swelling occurs in the neck, armpits, and groin, and typically develops within the first few days. If this happens alongside a fever, it's a significant clue. Chills, muscle pain, and a feeling of weakness may follow. Many people brush this off as normal flu-like symptoms, but with MPox, these signs are often a precursor to more serious developments. At this point, you might be thinking, fever, muscle aches, swollen glands. These could be symptoms of just about anything, right? And that's exactly why MPox can be so dangerous. It hides behind common signs. But there's one symptom that makes it stand out, and this is where it gets serious. The rash. Let's break down what that looks like and why ignoring it could be a big mistake. After a few days of flu-like symptoms, a rash appears, typically starting on the face before spreading to other parts of the body, like the hands, feet, and chest. What's alarming is the way this rash evolves. It starts as flat red spots, but within days they turn into raised bumps. Soon, these bumps fill with fluid, forming painful blisters. It's important to note that the rash is highly contagious at this stage. Direct contact with these lesions or even shared objects like bedding can spread the virus. Over time, these fluid-filled blisters will begin to dry out, forming scabs that eventually fall off. While this process can take up to a month, it's during these final stages that the risk of transmission is highest, as the virus is present in the scabs. For many patients, the rash heals without issue, but some may experience permanent scarring, especially if the lesions become infected or are not properly treated. One of the biggest risks is scratching or damaging the lesions, which can lead to secondary bacterial infections, making recovery longer and more complicated. In rare cases, MPox can affect other organs, leading to complications like pneumonia, eye infections, or even sepsis, which can be life-threatening. If you or someone you know develops a fever, swollen lymph nodes, and a rash that progresses as described, it's critical to seek medical attention immediately. Early diagnosis allows healthcare professionals to provide supportive care and limit the spread of the virus. It also helps prevent severe complications and long-term effects. MPox can be diagnosed through laboratory testing, typically by taking samples from the lesions. If diagnosed, it's important to isolate to prevent transmission, especially since the virus can linger on surfaces and in scabs. Maintaining good hygiene, washing hands frequently, and disinfecting surfaces can drastically reduce the chance of spreading MPox to others. Now that you know the signs of MPox, what can you do to protect yourself and others? First, stay informed. Keep an eye out for reports of outbreaks in your region. If you see or experience any of these symptoms, don't wait. Contact your healthcare provider immediately. Share this video with your friends and family to spread awareness. The more people who know how to spot MPox early, the better chance we have at stopping it. In our next video, we'll dive deeper into how MPox spreads, from human to human transmission to environmental contamination, and most importantly, how you can prevent it. Make sure you hit the subscribe button and turn on notifications so you don't miss out. Let's work together to protect our communities.